Welcome to the latest podcast from the Plastic Surgery Journal Club. Each month we review and appraise a journal article from PRS and summarise it for you in this short podcast. The full paper can be obtained from the PRS Journal website.
This is Jamie Marici talking with Dr. Jen Law following the June 2016 Plastic Surgery Journal Club at St Vincent's in Sydney. The next paper we discussed was the three-dimensional topographic surface changes in response to compartmental volumization of the medial cheek, defining a Malar Augmentation zone. This was from May 2016 out of Kansas and New York City by Stern et al. So, Jen, what was this paper about?
Surek and Plast described the distinct fat compartments within the face, and this article looks at what happens when you inject one specific compartment in the face, that is the deep medial cheek compartment, and how does that alter the 3D topography of the face, and what also happens when you release the arcus marginalis, which is the superior boundary of this space.
Yes, this was quite an interesting paper where they had 4 cadaveric heads. They used applesauce as a fat analogue. The landmark for injection was a line transecting the medial limbus with the alar base and injecting incrementally 0.5, 1, 2, 3 and 4 mils of applesauce. And what did they find?
They found that this augmentation zone was trapezoidal in shape. They found that the perimeter, vertical and horizontal diameters steadily increased but reached a threshold around 2 to 3 cc's of injection. They found that the arcus marginalis was a superior boundary, and upon its release, the augmentation zone changed to a shield shape, but that the other diameters did not differ.
This paper utilised 3D vector technology in order to quantify the augmentation as a result of the injection of the fat analogue into this particular space, and also to further analyse the effect of arcus marginalis release. I guess because they've established this as a baseline, where the authors can go from here is looking at clinical cases doing exactly the same thing, fat grafting with or without arcus marginalis release, and then finally look at what augmentation of other fat compartments within the face has on the aesthetic results. So, Jen, what were the good things about this paper?
This was quite a novel type of study. It incorporated new technology, especially the 3D photography, and it aims to quantify the surgical techniques in relation to what we see and the outcomes and the results of these procedures. This is also an interesting springboard for future studies, and I'm sure there will be many studies to follow in terms of the fat compartments of the face.
Did anyone raise any issues with the study?
There were several issues that were raised. One of the other journal club attendees mentioned that the authors didn't specify whether the injection happened with the cadaver supine or erect, and didn't analyse the effect of gravity. Also, we weren't sure as to how fresh the cadavers were, and also it would be quite difficult to translate the results to the individual patients who may have individual compartment size differences, variability in skin elasticity, overlying soft tissue, and that there is a lot of difference between cadavers and humans.
Thank you for listening. For more of our podcasts, head to soundcloud.com or subscribe to us on iTunes and search Plastic Surgery Journals. Remember to like us on Facebook and follow us on Twitter. Thanks also to the PRS Journal team for their ongoing support.